We're back on Campaign de Cuellar after a little hiatus because we've been so busy.
Traveling.
We've been doing a lot. It's not just travel,
No,
right? So the last time that we were here, we were going to an event, which was the Gina Hinojosa launch event. And that's the reason why our last episode was so short.
You met her?
Yes, I met her. She was very inspiring. Got pictures. They came out bad, but I still got pictures.
That's what happens when you're going through a line and you have to just get the picture as quickly as you can.
Yeah, I need a professional photographer surrounding me constantly. I don't have that. So after that, it continued to stay busy. So I went to the breast cancer walk in Weslaco. That was very inspiring. A lot of people were out there. Talked to a lot of people about health, promotion of health in general. And then I went to the No Kings protest in Weslaco, which was the first No Kings protest out there. And I was amazed at how many people were out there.
That's great.
There were a lot of people on both sides of the street, even across Old 83. And it feels good being around other people who feel similarly to you. That makes you feel just better in general about your purpose.
I think it's inspiring on the hard days.
Yeah.
Because there are hard days.
Yeah. It's important to get out there and be with your community. That really helps psychologically.
And then court is still going on?
Oh, yes. I'm still trying to put in my externship hours. So I've done a lot of court, a lot of law office time recently.
And then the cool part is you were on a panel.
Somehow I got on this panel with some other very inspiring and prominent people like Morgan Lamantia, Eric Olguin, and we talked about Texas state constitutional amendments. So did that on Thursday. And then Friday, unfortunately, I had to go to a funeral. Something interesting happened to me before I went to the cemetery. I took a little pit stop because I found out that I brought the wrong sunglasses. Comet chewed up my sunglasses.
Way to go.
So I thought, let me go buy some new sunglasses at Academy. So I did that, and that took me through a different route. So I went through the back roads of Weslaco and Mercedes. And I was looking at all the poverty that was in those areas, and I was thinking about how we really need a change agent here in South Texas to help lift people out of poverty. It's not about handouts.
Right.
It's about people having a fair shot at having a good, comfortable life. And I was looking at those houses and I was thinking, I don't think that a lot of these kids are going to have SAT prep courses. I don't think a lot of these kids are going to have tutors. And that's the thing about the Trump administration. Their whole anti-DEI thing, it's not that our kids are less deserving, it's that they're less prepared.
Right.
And then I also thought about how affordable healthcare helps lift people out of poverty as well. One family member's poor health, inability to access healthcare, can basically affect the entire family. So it can affect, the options that other family members have as far as what they can do with their lives. It can affect the economics of the entire family, maybe having less money because that one person's health is in such bad shape and they're not able to afford care. I also thought about how a federal living wage would really help lift a lot of people out of poverty because a lot of the jobs down here that are not considered like a white collar job are basically very low paying. And so the minimum wage here is $7.25, and a lot of times the wages that are paid here are close to $7.25, if not $7.25.
By DEI, you mean just level the playing field?
I think that the Trump administration, the Republicans, have really weaponized the term DEI, and they've used it as like some kind of bad term. Mm-hmm. And I don't think that they even really understand it.
They don't understand it because they've never lived it.
Yeah,
they've never driven through the streets of Mercedes or Weslaco.
Yeah, or been around those types of people who didn't have all these advantages, who didn't have tutors helping with homework, things like that.
Right. How do you compare? And then we're never given those opportunities because their parents had the opportunity to send them to those prep courses.
Right. The
parents here are just trying to get food on the table.
Right. And not just that, like some of these people like Trump, Tucker Carlson, they send their kids to boarding schools. These are like $70,000 a year boarding schools. And the level of education there is usually going to be better than a public school in the Rio Grande Valley. It's just the honest truth.
Yeah.
It's not the fault of the teachers. It's just there's a lot of money behind those boarding schools.
Smaller class sizes.
Yeah, smaller class sizes. They may have teachers who are PhDs. They just have a lot more available at their fingertips.
Right. And then you headed off to Vegas.
Right. Not really to just party.
No.
It was to run a half marathon because my brother Nathan had me sign up for the Las Vegas half marathon. We wanted to head out a little early because we had to go to the expo on Saturday and get our packets and stuff. And so then got there Friday, ran on Sunday, and it went really well.
Yeah.
I mean, as well as it can. go. I mean, running's hard.
Kudos to
You
y'all.
had to
I'm
push
not
through
going to
a
do
lot.
that. Was it cold?
It was initially cold, and we had to wait about an hour and a half in the coldness before we ran.
Not fun.
We're
No.
we are thinking about doing it again.
Y'all go on your own. We'll watch and cheer you guys, but cheer for you, but no,
Yeah.
we're not doing it.
Yeah, the interesting thing about running is that usually it doesn't go perfectly, especially when you run a distance like 13.1 miles. I had to push through a lot of pain. I'd have a cramp in my foot, and sometimes I like to just walk through it, but I decided to just push through it this time. Probably about 8 different instances of that.
Like 8? Did you drink enough pickle juice or something?
I was drinking a lot of stuff.
That just shows how dedicated you are and you're a woman of your word.
I also redlined it at the end. I was like, let me try to sprint at the end.
Oh,
Heart rate was 189, 190.
What the heck?
I mean, my average heart rate was 177 for the run.
Really?
Yeah.
Dang, you have a really high heart rate.
Yes.
That's insane.
Yeah. So I started at 170s, and I felt very comfortable at 170s.
Really?
Yeah.
You didn't walk yourself into the ER to see why your heart rate was so high? That's just your normal?
That's what happens.
That's all right.
Yeah.
Is your resting heart rate lower?
Yeah.
Okay. So you're an athlete.
I've been hitting like 40s.
Okay, you're an athlete. Okay.
Yeah. I guess.
Cool.
I don't know.
Allegedly. That's our favorite word. Allegedly.
You were busy too, and that's the reason why we're on hiatus. So
Yes, Dr. Cuellar is going to make me talk about myself.
I like to brag about the people that I have on my team.
So in 2022, 2023, I was a White House Fellow. It is a nonpartisan program that was developed under President Johnson and John Gardner. It is a program to bring in people from different professions, to bring them to the highest levels of government, so that while they're making policies, they have a true depiction of actually what is going on in the country. Personally, I was under the Biden administration, and I was at the Office of the First Lady and the Department of Health and Human Services.
Okay, and how many White House Fellows from the Rio Grande Valley have we had?
Since the 1960s, there's been 2. There's
And
one.
she's on my team, just FYI. That's how good I am at finding people.
There's one male, and he lives in D.C.
Yeah.
And me. The whole purpose is to just shine light upon the Rio Grande Valley. And
Yeah.
so I got to go to our conference. I was on the board for the White House Fellowship, and we got to talk about you. They're really happy donating to you.
Yeah. Nice.
I'm excited about the race down here and excited about our involvement.
So you made me sound good, so that's good.
Of course. I'm a great hype woman. But so we had to go over there for the conference. And then, while I was at the White House, my mom was diagnosed with stage 1 breast cancer. And my assignment at the Office of the First Lady was to study patient navigation for cancer patients. I figured out how to pay it, but I couldn't figure out who would be the best person to navigate the patient. Should we hire people? Should they be medical assistants? And finally, when my mom got breast cancer and I came home for a visit, all of her comadres came over same day, just so happened. And they were just mentoring her, saying, okay, she had a double mastectomy. So they said, you're going to need certain pajamas. You're going to need a lift chair. You're going to need a shower chair. Things that even as a PA, by the way, I am a PA. I'm a physician assistant. Let's get that out because we've had Ada's brother and sister-in-law.
Sister-in-law, probably others.
And maybe you, who thinks that I just wear scrubs to match Doc. Not true.
That would be weird though, right? For you to just to wear scrubs randomly without any medical job.
You go buy them at Walmart.
At least a medical assistant, like
It'd
something.
be like Halloween every day. No. So as a PA, I didn't know how to help my mom because I knew all what to do medically, but in the recovery and the preparation. And so we developed a nonprofit, Rosa de Esperanza. First program is Las Comadres, where we help mentor other people. And it's very individualized. So my mom, stage 1, 60s from the Rio Grande Valley, will then mentor another stage 1 lady, 60s from the Rio Grande Valley. Then we have equipment that we hand out. And then the last thing that we do is encourage, especially Latino women, to get genetically tested for breast cancer. There's not enough of the pool. So as a survivor's daughter, I should go and test my genetics. But truthfully, I will be compared to white women. And so they might say, Vanessa, you're never going to have breast cancer, but that might not be accurate.
Okay.
So that's what we do.
It's a lot.
Yeah. So Doc let me.
Let you?
Well, I had to do it. Like that was already on the books before the campaign.
Right.
Yeah.
I was like, what? I didn't know I had an option here.
No, not really. That was already in the books. DC was good. DC was good to spread the word about you. And y'all, people watch Texas very closely. You'd be surprised. And that is why I support Dr. Ada Cuellar. Because when I was in DC, and even now, the people that we have put forth, they think that that is who represents us. And they think that that's how smart we are. And we're a lot smarter.
And that's why we need me, because I will really represent us well.
We need an educated person.
Right.
To be able to, knowledgeable person, more so.
Yeah.
To represent us well so that when they hit you from all angles, because it does happen, that you have the education and the knowledge just to know what would be best for the valley.
But I will say that I don't really think about my education. When I introduce myself to people, I forget to say my education, because I don't really see myself as that being my identity.
Right.
So you have to point out that I'm an emergency medicine doctor and that I'm almost a lawyer, because I don't really think about it.
But I think it's most important too, but you're a daughter of Weslaco.
Yeah.
You're a daughter of the Rio Grande Valley. You're a daughter of District 15.
Right.
And that is the biggest knowledge that you can take to them. That's why I support Doc. So that segues into our next topic of conversation.
Which is? Oh, the ballroom?
The ballroom.
Because you were there a lot at the White House.
I'm very sad because that was my office. The East Wing encompassed the office of the First Lady, office for the military aides, and also the legislation aides or affairs. I may have that wrong. So it was working office space that was in, I think it was there even when Eleanor Roosevelt was around.
Okay.
So for me in particular, it concerns me because we have laws in place to protect our older buildings, our history, the history of this country.
Well, though I did look it up, and technically there are not really much laws regarding the White House.
Right. But I think it was just insinuated that it's the White House. You protect it.
Okay.
Just like you would protect a historical house down in your town. I think what's most concerning is there usually is a sequence of events that have to happen before something happens to the White House.
Yeah.
Congress is, if it's a vote and everybody thinks it's a great idea, it's the people's house. It is a time for us to come together and say, okay, changes need to need to happen because, old houses get old, renovation needs to happen.
Yeah. So for context, we're having this huge ballroom built attached to the White House.
There's proposed $300 million now.
$300 million that's allegedly being funded by donor money. So I'm very much a big picture person, and I just want to know more as far as why is this a bad thing for us to build this ballroom?
In my opinion, it is unnecessary at this moment in time. We're in the middle of a shutdown. There are a heck of a lot more things that we could be focused on. Donors are donating. Those donations could go to our food banks.
Right.
They could go donating to our healthcare system.
Right. I did think about that.
Yeah.
It's donor money, but why isn't it being used to maybe start a new medical school, a new hospital, things like that?
Things of importance. A ballroom is an aesthetic thing that they only use how many times a year?
So is this basically like representative of this administration just caring about vanity?
Honestly, you got rid of working office spaces to put a ballroom. It's very much telling of what their priorities are.
Yeah.
And
it's also funded by donor money, but at the same time, what's going to happen in the future? Because the upkeep, I don't think is going to be funded by donor money in perpetuity.
And the way if you look at it, they had an aerial view. They got rid of the East Wing, and honestly, they didn't have to because they were putting the ballroom perpendicular to where the East Wing was. So I don't know why. They just for design to make it look nicer. I don't know.
But the bigger issue is, why are we doing this? Like philosophically, why are we spending money on this? So you mentioned the government shutdown. So at this point, we're over 25 days into it. And I'm starting to feel, and I have a very independent streak, I'm starting to feel that the shutdown should end at this point. I think that there's been too much pain at this point. And now that people are going to lose SNAP benefits, people have been without a paycheck for some weeks now, I think it's gone too far. For me, what I would do at this point is say, look, I've taken my stand. I have done what I have to do because we need to get health care. if you guys are not willing to do something for healthcare for people, I mean, that's terrible. But at this point, people have reached a point of maximum pain. They're talking about how they're having to go to food banks because they don't have any money anymore because they haven't gotten their paychecks. And then now even the food banks are lacking in resources. And then you have people that rely on SNAP benefits. Now, I will say someone said rely is a bad word. Okay, rely does not mean that those people are lesser people who are not doing the work and that's why they need SNAP benefits. It just means that some people sometimes need a little help, especially when you don't have a federal living wage. A lot of times it's just not enough,
Right.
the money that you make. So anyway, that little tangent. So, people are getting to the point where they're not going to get their SNAP benefits. Like, I don't want people to starve. Like, to me, that's gone too far.
That says a lot about you, because what the alternative is, okay, in the shutdown,
Right.
they're going to pass these premiums going up
Right.
114%.
Yes.
And who's going to see the brunt of it?
Well, I think both options are bad.
Right. But who's going to see the brunt of the 114% up on your premiums?
Yeah.
Essentially, they're going to get rid of health insurance for their family.
Right, for sure.
And then where are they going to end up? Who's going to take care of them?
Right.
You. On the short term, people need to eat.
No, yeah, I'll take the patients in the ER.
Yeah.
I'd rather have people eating,
Right.
kids eating, people paying their bills. Like, people are starting to lose their homes. They're starting to lose their cars. Like,
Right.
that's gone too far. And I think at some point you can say, look, we've taken a stand. The Republicans don't want to do anything for healthcare. We've done what we can. And you'll have to deal with that at the midterms. I don't know. There's like no right answer. But I feel like at this point, I would say it's gone too far as hurting people. And yes, it's going to hurt people as far as healthcare too. But if the Republicans aren't going to do anything and they're just going to let this shutdown continue, I just can't let people starve.
Yeah, it's rough. So keep calling in and bringing questions and whatever you want to ask Doc. 956-320-9073. She's everywhere. Events all over District 15. So if you get wind of one or if you want a schedule, please reach out to us and you guys can go and meet her.
Yeah, and don't forget to go to drquedforcongress.com and donate.
Thanks, guys.